Hello, everyone, and welcome back to session 2 of My Brain and Medicine. Just a quick housekeeping reminder, please do use the Q&A box to ask your questions. Do take a break if anything feels triggering for you or it's all a bit too much. These talks are recorded, so you'll be able to watch them back at another time. I now have the wonderful pleasure to introduce our next speaker, who is the wonderful Dr. Bonnie Kate Dewar. She, again, is a long-standing member of our scientific panel and absolute expert in all things neuropsychology, in particular with encephalitis. So I am going to hand you over to her to talk about emotional changes after encephalitis. Over to you, Bonnie Kate.
Thank you, Philippa. Now I'm just going to use the wonders of modern technology to share my screen. Okay, great. Okay, so yes, my name is Bonnie Kate Dewar and I'm a clinical neuropsychologist. And today I'm going to be talking about emotional changes following encephalitis across the next 20 minutes. So, okay. So from a neuropsychology perspective, I'm sure as many of you know, encephalitis can cause cognitive, behavioral, and emotional changes. And this can be whether it's from an infectious cause, autoimmune, or even if the encephalitis, the cause of the encephalitis was not determined. So today we're going to be talking about the emotional changes. And I'm going to be just sort of briefly looking at changes including mood, anxiety and stress, anger, irritability, and then some changes to sense of self and adjustment to the changes caused by encephalitis. Now, when we think about the emotional changes, they can actually occur as either a direct result of the brain illness, the inflammation, or it can be an indirect effect, but most likely it is a combination of both. So when I talk about sort of direct emotional changes, we might think about some, for example, anxiety that arises from a change directly to the neural pathways that sort of underpin that emotional expression. So someone, for example, may become quite anxious if either say that they have memory difficulties because they cannot sort of update or have a strong sense of what's going on from point to point. People might become quite fixated with dysexecutive problems, and that causes anxiety. But I would say probably more commonly what I might be talking more about today are these indirect effects. So again, as many of you know, encephalitis can have a seismic change on so many aspects of a person's life, their relationships and who they are. And it's the emotional reaction to that that gives rise to this, mood changes, anxiety, irritation, these sorts of things. So I will be talking about briefly some ways to manage emotional changes. But I would say that, particularly with professional hat on, management of emotional changes, of course, needs to be considered holistically, considering all of that person and their life and their relationships, where they are, but also looking from a neuropsych point of view at the cognitive and behavioral changes that come along with the emotional changes. So, for example, if talking therapy is recommended, someone should also have an understanding of, say, if someone has memory or language problems, so they can really benefit from the recommended treatment, such as the talking therapy. So changes in mood are very common following encephalitis. What might that look like? So low mood might look like someone being very, very tearful, crying a lot. But of course, also be someone being very quiet and withdrawing from their usual activities, whether it's sort of just losing interest in even everyday tasks, personal care, engaging with friends and family. People might feel a sense of hopelessness, that nothing is going to change in their situation and the future is looking fairly bleak. With that may come sleeping difficulties. So a person may have difficulty falling asleep or have early morning waking and then be unable to return to sleep. For some people, low mood may actually express itself as just a restlessness or an irritation. And unfortunately, with low mood, many people then do have thoughts of self-harm. And this is something that we, of course, need to really keep a close eye on because of sort of the really negative effects that may lead to. Changes in mood and many of the other emotional changes do have an overlap with some cognitive changes seen after encephalitis. And this is why I would recommend a good assessment with a professional who can then tease out what's going on. Is it one of these direct cognitive effects? Is it an emotional or behavioral effect? And that will then inform the best treatment to really untangle what's going on. Okay, so how can we manage these mood changes? So as I mentioned before, I will be recommending that professional help is the point of call. This might be your GP as a starting point, who might be able to recommend talking therapies, psychological, even psychiatric resources. There might be a role for medication in managing mood changes. It might be looking back at sort of the acute hospital that was involved in your care, your family members, friends' care, or it could be sort of the rehabilitation service you may have been involved with. So there can be talking therapies that help with changes in mood. In the absence of that, or realistically, maybe whilst waiting for that, one of the approaches to help to manage low mood and this loss of interest and this withdrawal is an approach called positive event scheduling. So it's identifying with the person who's feeling low and who's struggling, recognizing and acknowledging that it's an understandable reaction to the significant changes brought about by encephalitis. But then looking at small tasks that they can do that just make them feel good and give them a sense of satisfaction and joy, and planning to do those. The person who is low in mood following encephalitis might need some support to kind of come up with those ideas, what they might be able to do. They might need support in actually planning how to go about it, when to do it, and then a gentle nudge to actually take part. When you're feeling low in mood and have that sort of that withdrawal, the loss of interest, everything can seem difficult and insurmountable. And so, you don't do things because it's just too hard and it's not going to work anyway. But the idea behind positive event scheduling is that by actually encouraging activity and then reflecting on what that was like, maybe it wasn't so bad. Maybe actually that was, that did make me feel a little bit better. And just then sort of cheering on that small win and trying the next goal and then the next one to get that momentum going, to allow someone to maintain activity, build their confidence, and also their sense of self-efficacy that maybe I can do this. That's something that a professional might adopt, but I think it's something that, whilst waiting or independently of professional input, is something that's worth trying. I think it's very important across any kind of emotional change post-encephalitis to look at sleeping problems. I mean, you should never discount the negative impact of sleeping difficulties on mood, let alone mood, cognition, behavior. So again, it might require a trip to the GP to sort of see if there's any medication that might be used in the short term, or any professional help that might assist. Otherwise, there are many resources about just establishing good sleep hygiene practices, looking to ensure that, if someone is napping during the day, fatigue is a common change and problem after encephalitis, but that those naps are managed so that they don't have a knock-on effect on sleep later in the evening. Looking at, not relying on caffeine. People do feel tired after encephalitis, but making sure they don't sort of, have many cups of tea or coffee or caffeine-based drinks, keeping these things in mind. Sleep hygiene can also involve having a routine before you go to sleep. We all know about reducing screens. We all know that that's very difficult, but that kind of reduction, maybe having some people find meditation useful, a comforting bath, something to sort of really sort of wind down before attempting sleep. Because it's really important to protect sleep, which then can have, not sleeping well can have a knock-on effect on how you're feeling. Another common emotional change following encephalitis is that of anxiety or stress. So, anxiety more around increased worry, stress, the feeling of pressure and, possibly time pressures. With anxiety, that might actually look like, at one extreme, this feeling of panic or fear. And with that comes a raft of physical changes as the anxiety or fear hits. So someone might notice that their breathing is changing. They can become almost hyperventilate. They can notice heart racing. They might have racing thoughts. They can get pins and needles and just feeling a bit sick. Anxiety can be associated as well with someone becoming quite preoccupied or a little bit sticky in their thinking and being unable to sort of let that thought go. And instead, it might actually lead to rumination and worry about one particular theme or topic. Again, we've got these overlap with possible cognitive effects of encephalitis. If someone is anxious or stressed, again, it could be presenting, or they could sort of present as being quite irritable or snappy and agitated. And again, we have sort of difficulties with sleeping. So how can we understand, and manage anxiety and stress? Again, I would, if you're concerned about, your worries, your stress, or your family members or friends, a visit to the GP to see what resources are available may be beneficial. A psychologist will typically, can adopt, there's different approaches, but may adopt a cognitive behavioral therapy approach. So it's looking at that anxiety cycle, which is typically what happens is in a situation, the body responds with these breathing changes, the heart rate changes, pins and needles, and those bodily signals will send a message to the brain saying something's not right here, you're in danger. That then leads to a behavior of shutting down, avoiding, running away. And what psychological input can do is actually try and develop sort of strategies to manage those physical changes, or more likely looking at the sort of the thoughts, the intrusive thoughts that are coming into your mind as you're feeling anxious, that are keeping that cycle going and maybe actually are not a true or realistic appraisal of that situation. So this helps us to understand how we can kind of get in to manage anxiety and try and break that cycle. The professionals have the training. They will be able to help you to do this. It can be very difficult to manage these emotional changes post-encephalitis by yourself. So as you can see on my slides, the psychologist will step in with more sort of looking at those thoughts, looking at ways to sort of think in a more balanced way so that, a person is able to sort of function and get through that anxiety. Absent professional input, there are other sorts of strategies that we can use to manage anxiety. These typically can address the sort of the physical changes. So strategies such as breathing exercises or relaxation exercises. There are now many good apps that are available that help with these sorts of relaxation and breathing exercises. So the Calm app, Headspace can be very useful. They typically do come with a subscription and would really be recommended to be used regularly to sort of establish a habit of using, having strategies to manage the anxiety and stress. But what breathing can be really useful. It's something that's very simple. It does require practice to put in place. But when the anxiety hits, or when stress and things are becoming too much, to slow down the breathing. It could be just 5 deep, slow breaths. There's another technique called box breathing, which, again, the Google will tell you about sort of the strategy of breathing in, holding, letting go, holding, which can be really useful. And that can be used sort of in the moment to de-escalate this sort of this anxiety cycle. Relaxation exercises have a similar effect, but they can actually lower the background level of anxiety and stress. So when put in a challenging situation, it's less likely that you tip over into a fearful or stressed reaction and either snap or, panic or avoid the situation. Some people also use various grounding techniques borrowed from mindfulness meditation to almost get out of your head and those anxious thoughts and those thoughts of stress and feeling overwhelmed, to check in with the here and now and be able to manage that situation, then leading further space, mental space and time to sort of understand and manage those reactions at a later time. Because it's really important with anxiety, management of anxiety, to keep activities going. Anxiety puts you in a situation where it's too fearful. I'm worried about that. I can't do that, particularly given all these changes following encephalitis. But by managing anxiety, and it's almost avoiding avoidance, can actually then sort of lead to greater sort of learning about what you can do, building in confidence, and actually allowing you to get back on track and do what it is you want to do. Okay. Another common change after encephalitis is that of irritability or even anger. So this might look at like restlessness, irritation, as I said, being quite snappy, or some people do describe anger outbursts or physical aggression. Changes in personality are very commonly described after encephalitis. And again, these might arise directly from changes to the neural circuits that express thinking and behavior post-encephalitis, or, as we've mentioned, changes in mood or anxiety can also lead to these outbursts or just irritation or snappiness. Again, I would recommend that a first point of call is that of professional support. GP, psychologist, again, a psychiatrist might be someone who can assist. In the absence of that, I think it's a challenging one. With any emotional change, it's important to acknowledge that this is a very challenging time for the individual, your family member or friend. Sometimes with anger outbursts and aggression, that can be maybe more difficult. A person may not want to admit that this is a problem, and they may have insight difficulties because of the encephalitis. They may be very embarrassed by their behavior. What can help, again, in the absence of professional support or was waiting for that sort of appointment to come through, is to keep a record of the outbursts. If we're talking about sort of problem behaviors, keeping a record of the outbursts and then getting a picture of what's happening around that outburst to try and identify any triggers. It could be that there are particular situations that are more likely to lead to outbursts or aggression or irritation. Is the person fatigued? Is it got something to do with pain or reduced sleep? Is the environment, quite sensory stimulating, so it leads to information overload? And by actually building up a picture of possible triggers, then there are the steps that can be taken. So we might be able to adjust the environment to maybe, have a rest before that social gathering, so it's less likely to lead to an outburst, or to have strategies in place, knowing that this is a tricky and challenging situation. And so if these sorts of triggers are arising, then it's time to just either distract yourself or distract your family member or friend, or to step away from the situation, use some of those even breathing techniques, grounding techniques, and then return. So just allowing more of an understanding of what's going on, so it doesn't seem like it's coming out of the blue, and bit by bit developing a sense of mastery and being a bit more in control, so that you and your family member or friend are able to engage in what they want to do as they would have before the encephalitis. Just finally, I wanted to kind of wrap this up by looking at changes to sense of self. And I understand that the next speaker is going to be talking about adjustment to the illness. So changes in mood, anxiety, stress, and this irritation and anger, frustration, do reflect sort of, or can reflect an individual's experience of feeling very different to who they were prior to the illness. So there can be a real loss of sense of self and maybe a mourning for that, anger that they have, found themselves in this situation, quite apart from sort of life may be very difficult and very different now following encephalitis. So this is where, psychological therapy, of course, can really help with the personal journey of acceptance of these changes. In addition to some of the strategies to manage mood and anxiety and anger that I've talked about today, but it's a much more about work of trying to sort of bring together who you are now, who you were before, and seeing if there's a way to kind of put the pieces back together in some way with which you feel comfortable with or accepting of. Not everyone requires this journey. It can take a long time for some people. But it's of course, as we know with encephalitis, in some respects it can be very different for different people. Okay. So just to finish up, I've talked a bit about sort of professional supports and where to go. I think that sort of there is a role for the rehabilitation team, maybe who you're engaged with to begin with. Talking therapies may be referred to by your GP for further support or medication. And then, of course, the wonderful folk at Encephalitis International, who will sort of, provide, as you know, many of you know, peer support to talk about similar experiences with individuals, family members, other, carers, friends, but also as a source of resources that are available and a really strong listening ear. Thank you. So I'm more than happy. We've got some time to, if answer any questions that you might have, and I'll do my best to see how I can help.
Fantastic talk, as always. Thank you so much, Bonnie Kate. One question that's come in that I know a lot of people ask is there a time frame for recovery?
With respect to emotional changes, unfortunately, I will say that it's different for everyone. And I think that emotional changes as well can be quite subtle in their emergence. Some people will sort of, after their illness and even whilst they're still in hospital, will be quite worried or stressed. But then as they, leave home and life doesn't just click in back to how it was, that can then give rise to a lot of frustration, or mood can dip. Similarly, people can develop, as their cognitive recovery is improving, they may actually then become more aware of the difficulties. So there is a different time course there. So I think, and then some people almost, they don't really have, pronounced emotional changes. It's, it is very different for everyone. So I don't think, unfortunately, that there is, a time scale. But what I would say is that with support and input from professionals and family and friends and natural supports, these are things that can change. So we know that the physical changes to the brain will be at a point there will be limited recovery, but things like depression, things like anxiety, this anger are things that can change. So I think that it's always important to have hope, because there are ways to make things better and to look at things and see what we can do.
Certainly, and I think it's that whole, it's practicing, it's a muscle memory, isn't it? You've got these techniques don't necessarily work the first time you use them.
Yeah.
It's building it up and
Yeah.
not feeling defeated if in a week's time
Yeah.
the breathing exercise doesn't make it go away, those
Yeah.
kind of things.
Yeah. And it can be quite tricky, because it's almost like when things are really hard, and you've got this person going, oh, use this technique, use that technique, and it just seems really hard. So this is why it's celebrating those small wins. So
Yeah.
even like small steps that you can do.
Definitely. So bear with me. if somebody already had a mental health condition and then they have encephalitis, is that going to amplify those emotional symptoms, or does that have any influence at all?
I mean, it can do. I think it depends on what kind of, what their mental health history was like beforehand. So it might actually be, someone might be more vulnerable to not just the physical effects, but just these sorts of the blows and that are caused by, to everyday life caused by encephalitis. So it might be they may stumble more in their recovery. Um, they may then actually have access to resources or toolkits that they can then go back to. But it doesn't necessarily mean if you've had, say, a history of depression and then you have encephalitis, you may be more vulnerable, but it doesn't necessarily mean that you will then become low in mood following encephalitis.
Fabulous, thank you. For those people that very much recognize they have personality changes and emotional issues that go around that, how I'm trying to reword the question a little bit in terms of how do people get more resilience with that, recognizing it themselves, but then dealing with the fact that other people recognize it in you and
Right.
how that can, how their relationships, their work,
Sure.
that kind of thing.
Sure. I mean, I think it's about being really compassionate about those changes because, as I mentioned, someone might not have insight into it and can be really hard, but then the insight developed, then they become aware. And I think that it's just sort of being really gentle with that. And, it's not just about, oh, here are the strategies, you can use them, but actually then talking about sort of the knock-on effects of how that makes them feel. And recognizing that this is sort of it is common change following encephalitis, that it's understandable to be feeling, sort of maybe embarrassed or sort of upset that you're hurting those loved ones around you, allowing someone time to speak. I have been talking a lot about professional, input, but, sometimes it could be a mentor or a really close friend or someone at your church or someone in your community who might then also be able to just allow some of the, a listening ear to allow some of that pressure off.
Absolutely. And you talked a bit about medication to help with kind of depression or anxiety and those kind of things. Is there a likelihood that people that have had encephalitis and experience those are going to stay on medication for life? That's one of the questions.
Sure. First disclaimer, I'm a neuropsychologist,
Yeah.
so I'm not a medical doctor. So if you have any questions about medication, you should always check with your GP or your neurologist, your psychiatrist. I think it depends, and it will then, you have to liaise with your prescribing doctor. But from a neuropsychology point of view, and this is, when working with someone who has a mood problem or anxiety problem, the way I see it, it's not not everyone will need medication, but what it can provide is almost like a foundation, like a ground under your feet to feel just a little bit more stable, and then the therapy can begin, and then the change can begin. So I think that there is a role for medication, and you may not, most likely most people don't have to be on it for life. They're not addictive substances. Again, in my experience, I'm not a medical doctor, but it can have a role with some people, and it can be really useful just to kind of get things started. It's very, all the research shows that it's not just medication or talking therapy, it's generally the combination of both that has the best effect.
Thank you.
Yeah, and again, sorry, just to emphasize that, things like mood, anxiety, they can be changed.
Yeah.
So, there is hope that things won't always be in a very sort of, sometimes very dark situation.
Yeah, absolutely. Another question, when should you see a neuropsychologist and when should you see a neuropsychiatrist? How do you kind of go down that process?
Sure. I mean, I think that sometimes well, from a neuropsych point of view, sometimes it is, and it's kind of like this, the last question, if it's that someone has, really mood problems or anxiety problems that are really beginning to kind of, it's really interfering with the day-to-day life and sort of really kind of maybe having greater difficulties benefiting from therapy, that's when I would recommend seeing a neuropsychiatrist. So yeah, I think that if say someone after encephalitis has got sort of, quite significant mood anxiety or sort of, anger difficulties such that they're really stuck and it's really affecting day-to-day life, then that might be where it's a call to see a neuropsychiatrist in liaison with sort of, ideally a neuropsychologist for that sort of talking therapy.
Fantastic. Thank you. Now, I am conscious of time, so I'm going to wrap up the Q&A, but if anything else comes through, we'll, of course, try and answer them on the Q&A box, or we'll make sure we get an answer for you after this webinar. So thank you again, Dr. Bonnie-Kate-Dewar, for your wonderful insights. Thank you so much. Now, to keep us on time, I am going to move us over to our next speaker, which is Dr. Andrea Pickering, who is going to talk about adjustment in identity for young people following a brain injury. So thank you so much for joining us, Dr. Pickering, and I will hand over to you. Thank you so much.
Hi, Philippa. Thank you for inviting me. I'll just share my slides. Today, I'd like to speak to you about adjustment in self-identity after brain injury. I'll be presenting this talk, but this presentation has been co-produced with two experts by experience. This is an adolescent and a young adult who are brain injury survivors. Okay, so the aims of the presentation are to explore the experience of how young people perceive changes in themselves and the impact on relationships with family and friends. And then also the personal experience of the experts by experience who supported me in creating this presentation and their reflections on their journey. So when we look at the literature and what happens in the adjustment in self-identity, it picks up on a number of themes. And although this diagram is showing you a kind of process over time, that's not really the reality. Often these processes can happen in a different order, and sometimes we go forward 3 steps and go back 2 steps. Everything is unique in terms of this process. But in the literature, it's certainly highlighting a number of areas that are important. Firstly, knowledge to understand the brain injury and developing a self-awareness. I think previously someone used the term of insight. So being aware of the difficulties that may have been developed through the brain injury. The second part is therapeutic support to explore the feelings and thoughts about the self. And it's important for this to be a confidential space because often young people don't want to kind of upset family members or friends where it might be really difficult to be honest about how they're feeling. So a confidential, trusting space for them to express their emotions and really reflect on it. Part of this is adapting to acquired disability and also learning self-regulation strategies. This may be about behaviour and also emotion. The third part is fitting back in, and this is fitting back into the social and physical landscape of life after a brain injury. There are lots of changes within the social structure around the young person. For some, they may be able to reacquaint with their friends before the injury, and for others, they may not be able to, and there's a shift. There's also physical changes. There may be moves in home, there may be moves in school as well. So lots of physical changes for the young person to adjust to. And for all of this fitting back in, it's about promoting inclusion and participation for that young person, improving their possibilities and opportunities to develop and reacquaint with peer relations and participate in age-appropriate activities. The last part is adjustment. Oh, I'll just go back there. is adjustment in family circumstances. So really taking into account the changes that have happened for the family. We understand that families go through a number of stages throughout their time. You know, for the parents, they are individuals that come together as a couple, and then they have young children that they bring up to adolescence, and then they launch these young people into the world. And sometimes those stages have to be altered following the brain injury. Sometimes it may be that they have to go back a step because of the recovery following the brain injury. So it's taking that into account and understanding how that has impacted on the family structure. So in thinking about what is supportive for young people, the formal educational structure, when I'm thinking about the UK, is a positive for young people because it allows an equity of access to support, particularly through a special educational needs provision, which then can provide the funding for support. That might be through a learning support assistant, and also interventions that can be deployed within the classroom during the school day. Adolescence is also a window for neuroplasticity and promoting potential for developing capacities and skills. So we know that this is supportive for young people at this stage of their life when they're having a brain injury. The other part which is supportive is strong family bonds, and this comes through all the time in research and through our conversations with young people and family members. The shared experiences and working through these really tough, difficult times really strengthens these relationships, and they are really key to recovery. The rehab team as well, to advocate for the young person to access all of the appropriate support. It's really key for that young person to have that team that is behind them and helping them to access personally meaningful provision. When thinking about a research project that we've carried out at Canterbury Christchurch recently, we interviewed 7 young people between the ages of 15 and 21 who had had a brain injury during the period of adolescence. That's during the teenage years. And what they reflected on was a number of elements that we acquaint with the adult brain injury experience. So they were aware of a duality of self from what I was before the injury to what I am now. And this was experienced intrapersonally, meaning within themselves through thoughts and emotions, as well as interpersonally, so between themselves and others. So, for example, family members and friends. And they were able to compare how things were now with the past in social situations and relationships. They also picked up on an incongruence where some things changed over time, but also some things have stayed the same. So it's not that everything has changed, and it's a period of time to understand the self and work out what has changed and what hasn't. And there's a quote from a young person that talked at the UK Acquired Brain Injury Forum a couple of years ago, and I coined this term because I think it really encapsulates the experience that he felt the same but different. So it's just not clear. It takes time to understand what has changed and what is the same. Also thinking about the experience of adjustment and self-identity, they approached it from a part where they could see their losses. They were aware of things that had changed, that they had lost, certain capacities, certain difficulties they'd gained. But there was also circumstances where they felt they learned something, they gained something, and this particularly was experienced in family relationships. They felt a real bond with their caregivers, and that was recognised throughout the research. So family is really key. And we need to be aware of that in terms of supporting family members. When thinking about the research that we carried out, so within the interviews, the results showed that there were 5 main themes that came out of it. The first part of the journey of adjustment was understanding who I am, developing that knowledge and understanding in relation to the brain injury, what was lost through the injury, what missed opportunities or expectations of the old self, but also what was gained as meaningful for family and friendships as they strengthened in their depth and understanding. And also what remained the same, whether it was an obsession with a particular football club, hobbies or interests that continue to define that young person's self-identity. The other part was intersectionality with race, gender and religion that came out within these interviews. And I'll use a few quotes as we go forward, so it brings the voices of the young people that we interviewed. So in terms of race, a young man described, race is something that we don't just overlook in our society now. My parents also told me that this is how the world is. Race actually shaped the way I perceive the world. In terms of gender, a young man spoke of, I'm overly emotional half the time. That's what I am now. I just make sure that no one sees that. I can't be over emotional because I'm a guy and I need to shield up. So being aware of the impact of gender and being a male on the experience following brain injury. And religion came through very strongly. I will say prayer and reading the word. They were my major steps for me. God loves everyone. Religion is actually very powerful for me. I fully believe in God. So I questioned, why did this happen to me? Why did I go into a coma? Why am I having these behavioural changes at all? Why did God let this happen to me? So for us to be aware of these elements that we need to encapsulate within our rehabilitation and support family members and young people alongside. So being aware of race, gender and religion. The second theme that came out of this research was, how do I relate to others? And this is considering shared family experiences, bonding through the adversity of the experiences, how roles changed for family members, the caring for young people, and how peer relationships could strengthen, but also could fracture as well. And that required a shift to fit maybe a different peer group that had a different shared experience. An acknowledgement also of talking in therapy about experiences with another person. That was certainly the experience of these young people, and they found it helpful. The third theme that came out of this research was an increased awareness of embodied experience and physical vulnerability. There was a self-perception of acquired physical disabilities and how this relates to the self. How do I own this new disability? And also a physical vulnerability because of the near-death experience and this concept of a fragility of life. So the young people would speak of living each day to the full because they're very much aware of how life can suddenly be taken from them. The fourth theme that came out was, what happened? What happened to me? And this involved building a narrative, a temporal order of events, of how this fits in to the young person's life story, filling in the gaps, and this is with the support of family members, the key anchors to the young people, helping them to understand their current life circumstances and the landscape around them that might look different now, building it all together. And then this process over time of adjustment. Again, I'll use the quotes from the young people. So starting with a process of shock immediately after the brain injury. And the young people described a dark place. My mindset was none. Then discovery and realization. Through this, I found out more about myself. I did minor researching about brain injury because what my parents were mentioning, and I sought it out myself. Reappraisal, so reviewing what has happened and reframing these experiences to understand them and make sense of them. The young people described, everything happens for a reason. I've seen life in a totally different picture. And then adaptive coping. I have ways now to control myself and manage feelings. I notice now in conversations when it could provoke me to react, and I try to withdraw and change the topic. The process of acceptance. I've got to accept it, not get frustrated or annoyed with myself. It was meant to be. It put me on the right path to become who I am now. And gratitude. I am so grateful and blessed. They did their magic and they kept me alive. It's made me grateful and thankful that I'm alive. And then post-traumatic growth is the final stage, which I don't think we can see on the screen. There's the pictures. But the young people described, it's made me more calm. I've been able to think a lot about who I am. I see myself as much stronger than I have ever been before. I have realized that I'm stronger than I thought, and I've gained self-respect. Following this research, we identified areas that we could improve things for young people following a brain injury, notably more research and evidence to look at interventions to support, as was mentioned previously, around talking therapies, interventions that are specially designed for young people following a brain injury and managing these adjustments. Being aware of cultural humility, so taking into account religion, taking into account race and gender, and being aware how this impacts on a young person's experience. Clinical practice, for clinicians to be aware of reacquainting young people with their values and helping them to carry out activities that are personally meaningful for them. Having therapeutic interventions that support them in their self-identity adjustment and including the family within that work. Here I have the experience of the adolescent expert by experience who supported me with this presentation, in which she describes her advice for professionals. And this may align with other young people who may be watching this and family members. Her view was that in acute care, she wanted staff to spend more time with her, understand how family members feel and provide supportive space to talk with them. Medical and nursing staff made time to speak with me each day about what was happening. In intensive neuro rehab, she described, don't make assumptions about me. Many thought I was blind, but I coloured in pictures and surprised everyone. Supportive staff played with me and tried to make hospital home from home. She guides us to think, focus on what I can do rather than only on the things that are difficult, and make me feel comfortable so I don't feel overwhelmed in situations. And in terms of community neuro rehab, she advised to keep going, even if it's difficult. In the early days, she reflected on being in a wheelchair and wearing a helmet a lot of the time. And now she's 5 years on and she wears a hat for contact sports. She has friends, she's in school, she has hobbies of music and drama, and she feels supported by her therapy team, and she advises to support her to try things and build her confidence again. I don't know if I can move my picture up. There we go, a little way there. So this is the experience of a young adult. He had a brain injury. He had 2 brain injuries. He had a traumatic brain injury and also meningitis during his infancy. And he's a young adult now, and he was reflecting on his experience. He described how in early childhood and primary school within the UK, he had limited knowledge and understanding about his brain injury and what had happened to him. Within secondary school, the therapy team came on board and supported him to understand his brain injury and also to work alongside his family members. He had had a hearing impairment following the meningitis, and he was supported into understanding the deaf identity and learning sign language. Now he's in university. He has an understanding of his brain injury, and he has confidence to ask for reasonable adjustments for his learning. And he now is wanting to become a filmmaker. He's studying at university film and media. When he reflected on the highs and lows of his experience following his brain injury over time, the lows that he identified and other young people may also identify with was the lows were that he felt unable to understand or articulate his feelings. He felt isolated, misunderstood, unsupported, not knowing how to seek help and struggling to make friends. The highs have been having therapeutic support from his team, becoming more self-aware of his needs, getting bone-anchored hearing aid, which has certainly improved his hearing, identifying skills. He started off with photography and that led into film, and he was on a filmmaking course at college, and now he's at university, and he's hoping to, when he completes his degree, go on to do a master's degree in filmmaking. And he has a really good group of friends who support him, and they have similar interests. A film that was very poignant for this young adult was the Batman film in 2022. And one of the quotes here encapsulates what he found meaningful about it, was when Batman described, "Our scars can destroy us, even after the physical wounds have healed. But if we survive them, they can transform us. They can give us the power to endure and the strength to fight." And that certainly is what he's taken forward in building his future. His advice for professionals working within neuro rehab, and this may align with other young people and their experiences, is that he advises to give space and time for young people to talk, particularly in multidisciplinary team meetings. Be guided by the interests of the young person when making decisions about the neuro rehab. Be an advocate to support young people to ask for what they want and need, and support them to assess the risk themselves rather than making the risk assessment for them. Help people to understand what they're going through, help them to come to their own conclusions rather than telling them what they should think, and empower and give people the confidence to make their own decisions. Our last thoughts from the 3 of us are the recognition that having a brain injury can feel like free falling into the unknown for young people and their family members, and it can feel a really lonely place, particularly when there isn't adequate support and guidance. And within neuro rehab, self-identity development in young people can be supported by providing knowledge and understanding of brain injury, acknowledgement of the non-linear, so it's not straightforward. There is no one way of experiencing this. Everyone's experience is unique. making meaningful connections for shared experience with family and friends, a supportive space to develop that agency, that ability to make decisions themselves, and working towards personally meaningful life goals and improving quality of life. A poem that I found really poignant in this is written by Shel Silverstein. So listen to the mustn'ts, child, listen to the don'ts, listen to the shouldn'ts, the impossibles, the won'ts. Listen to the never haves, then listen close to me. Anything can happen, child, anything can be. And that's certainly our view, myself and the two experts by experience, that anything can be. For both these young people, they've described their experience and being able to do the things that they want to do following the brain injury. Here are a number of resources that are helpful in the UK. So CBIT, Child Brain Injury Trust in Hand, which is an app that has a range of resources. The UKBIF Enables, which has resources for young people returning to school, and Headway.
Fantastic. Thank you so much for that really excellent talk, understanding brain injury in young people and kind of how that can change with the right support, the right tools and everything, that it's not all doom and gloom and there is hope. And I love that poem at the end. Absolutely. Yeah.
Absolutely. And there's no predictors either.
Yeah.
You know, so people who can have very similar kind of brain images and injuries, actually, because they're unique individuals, their brains are wired very uniquely, you can't predict what the outcome's going to be. So it's always supporting them long term to see where they go and what they can do.
Could not agree with you more. Love it. One of the questions that's come is, what's the best way to help explain the changes to friends? And that might be the young person explaining to their friends, or maybe a parent explaining it to kind of help support their child that their things have changed. How would you recommend?
I think in terms of particularly friendship groups, it can be through the school. So working with the school, and again, that might be the treating team, the professionals around the young person, partnership with the parents, to sit down with the school and think, how can we manage this? How can we think about this friendship group and this young person returning to that group? What information could we present to them? And thinking about the level to which we provide that information, what vocabulary to use. It's important to provide that information. It might be some schools choose to have an assembly, and when the young person feels able to lead that assembly and do a kind of presentation. Others feel they would want it only in their little class group. So again, it's down to the individual young person, but it's definitely working in partnership with the school on that.
Very good, thank you. I know we've certainly had, and I know the team would agree, young people share their story either at one of these type of events, or they might do it as kind of part of our YouTube series as well, or in peer groups. And I think that it's incredibly powerful to own your own story and be able to kind of give that information to other people and feel confident in doing that. I think it makes a big difference. One question is, what coping mechanisms would you recommend for those that feel that they don't have a supportive family or a supportive education system or friendship group? What's the best route to go down through that situation?
The route is advocacy, and that is through like Encephalitis UK, international, seeking those supports, or Child Brain Injury Trust, seeking out those professionals who can work alongside to support and connect you with other people who can kind of build that provision around you, because there are these supports out there.
Absolutely, yeah, I couldn't agree more. That's why we exist in many ways.
Exactly.
So yeah, all hope is not lost.
No.
Families take time to adjust, friends take time to adjust as well. But yeah, never think that you're alone in this, I think, is the message I would put out there, which we would all say. Lots of lovely comments saying how wonderful your talk was as well. Just checking if there's anything else in there. No, just more people saying, yeah, great, totally agree. So it's all good stuff.
Oh, good, good.
All
Because
good stuff.
I wanted the young people's voices to be through that. So yeah, I wanted to incorporate
Absolutely.
their
Yeah,
views.
definitely. Wonderful. Okay, I'm conscious of time, so I'm going to bring this to a close and just say thank you once again for that wonderful talk and really
Thank you.
appreciate it. And yeah, see you again soon. Thank you so much.
Thank you.
So we are now on to another quick break. We've got 20 minutes before we come back for section 3. Please do go get a drink, take some time away from the screen, process some of the stuff you've learned today as well. Remember, the support line is there if you need us at all. Thank you so much, everyone, and see you again in 20 minutes. Okay, bye.